welcome you all for our ninth Journal Club of PD Updates. I would like to welcome Dr. Hayathem Bin Hasher. She's the first Saudi female attorney and doctor in medical law and ethics, and she's the founder and CEO of the a medical law firm and her consultancy. So without further ado, Dr. Hayathem, the floor is yours and the presentation is on.
Assalamu alaikum. Good afternoon, everyone. And I'd like to thank the organizing team, first of all, for inviting me and recognizing the importance of medical law and ethics, especially Dr. Yara. ما قصرتي الله يعطيك العافية. So today I'm speaking to you wearing two hats, the hat of a medical law and ethics lawyer, but also the hat of a peer who completely understands that in your field of work, sometimes you don't have the luxury of time that the courtroom has. So especially in pediatric emergency medicine, time pressure is constant, but there's also the legal accountability. So my goal today is to give you a practical framework so you know when to act, when to escalate, and how to document in a way that is defensible according to the law. طبعا أبغى أوضح شغلة إنه إذا في كلمة غير واضحة بالإنجليزي، أنا حاولت قد ما أقدر إن أنا ما أستخدم عبارات legal because it's out of your scope, and I'm just giving you a roadmap, something that can be like your safety net. لكن إذا في أي عبارة غير واضحة please اكتبوا لي بالشات وأبشروا نشرحها لكم. Okay, so going back to the session, this is going to be an interactive session. So my slides are going to be extremely minimal because I would rather that you sit back and engage, and we will have time at the end for Q&A. So if you, if we do run out of time, please feel free to reach out to me either on my social media accounts or directly to my office. And I'd be more than happy to answer the questions. So let's go on to the first slide. So what is medical law? Usually people think of medical law as the law that punishes doctors. This is the belief that many patients have, but also many lawyers have, unfortunately, and also many doctors have. So it creates this kind of aura of fear. Tamam, but in reality, it is the framework that authorizes your clinical action. So it defines your duties and it determines your accountability when outcomes are challenged. So think of it as a 3 operational question. So let's go on to the next slide, please. So 1, do I have lawful authority to proceed? 2, what duties must I fulfill even when it's uncomfortable? And 3, can I prove that I acted with due diligence? So to survive the legal red zone, you need 3 disciplines to navigate those questions. Let's go on to the following slide. So we have the information discipline, which means that you are ensuring real understanding, not just a signature when it comes to consent. And this is the area where a high majority of legal cases appear because there is a lack of information. So either the information is being misunderstood or it's deliberately being withheld from the physician. The second part is the clinical currency. So staying updated on safety alerts, emerging syndromes, evolving drug reaction patterns. Sometimes in a clinical situation, when the clock is ticking, when the ED is full, it can get overwhelming, and that's completely understandable. But it's important that signs can be noticed and that they might not be misread or missed at all. So especially if it's a new outbreak and systems can be confused. For example, in the UK, now there's a meningitis outbreak. It started in a small town called Canterbury, which is actually the city that I went to do my master's in medical law. And in this basically little, let's say, city or village, there was one case. And it was overlooked. It wasn't taken seriously. They didn't identify it as meningitis. And then now you have an outbreak. So now you have it spread across the UK. You have multiple deaths, etc. So you can see how it could have been manageable, but unfortunately it got out of hand. So the third one is team coherence. Usually what we recommend to use here is the shell model. So communicate and execution. And don't become your exposure. So communication and execution don't become your exposure when something goes wrong. And if the shell model is not clear, I will explain it later on. So let's go on to the following slide. And this is the spine of the session. These are the 4 most important questions that I want you to ask every single time. So 1, is this an emergency? Is there a life, limb, organ, or severe harm that is at risk? Number 2, who can consent right now? Do I need to go through informed consent, or do I have an emergency situation where I can bypass consent? 3, what is in the child's best interest today? What harm are we preventing right now? And 4, do my notes prove my stance? Does it include the risk, reasoning, communication, and escalation? So now we're going to apply these 4 questions through 4 pillars that are essential and that basically determine your action as basically someone who's working in a pediatric emergency department. So let's go on to the following slide. And during this segment, what I'm going to do is I'm going to give you a question to start with, and then we'll answer. I want you guys to answer in the chat. And after that, we'll discuss the situation from a medical law perspective. Okay, so let's go on to the following slide. So the scenario here is a 14-year-old that arrives in severe respiratory distress. He is hypoxic, and you are considering intubation. The father says no. And they only want herbal remedies, okay? And they insist on taking him home. The mother is not unreachable, and the patient is deteriorating. So in this situation, what is your next step as the physician? Do you respect the refusal and continue non-invasive measures only? Do you proceed with life-saving measures due to imminent risk and document emergency necessity? Do you wait 10 minutes and try to persuade the father and try to reach the mother? Or do you transfer to another facility to avoid consent conflict? And I'll give you a couple of seconds to answer. Okay, so a lot of Bs. Does anyone have an answer that is not a B? Okay, let's move on to the next slide. So the first pillar is consent. So when it comes to consent, we always hear about the term informed consent, أو بالعربية الموافقة المستنيرة. Okay, so what does that actually mean? So you as a physician, every single day, make decisions based on your information, on all the knowledge that you've learned so far, from the first day of going into medical school until today. And every single decision that you make is informed. And it's a necessity that the patient or the guardian is also given that power. So they need to have all the information according to their understanding that will basically allow them to make an informed decision. And from a medical law perspective, if the information is not based, if the decision is not based on information, it is an uninformed decision, and therefore it is not valid. And this is where many issues arise for the healthcare team. So does the guardian understand is an important question to ask yourself. Or are we just making him sign? In a courtroom, the signature, like I told you, is not valid if they don't understand the reasons. And the options as well, they need to know what the other options were, what the side effects are, and what the possible risks are. And many physicians, unfortunately, belittle the importance of this. And this is due to many reasons. It can be to the difference in knowledge or the restrictions of time, etc. But the law is the law. So whatever the reason is, you have to go through that process. However, there are situations where we can bypass the consent. So in Saudi law, the emergency exception exists for a reason. If delaying intervention risks life, organ, or severe harm, you can then immediately proceed under the emergency threshold, which is Article 19 of the Law of Practicing Healthcare Professions. In clinical terms, you stabilize the patient first when truly critical, and then you document the necessity and escalate. So if you can obtain consent, leadership requires information discipline. So you must compress the information into plain language and make the informed consent procedure in seconds, basically. And always use a teach back question to ensure that they do understand what you're talking about and they know the severity of the situation. And then obviously stick to your hospital's protocol. So if you're using the electronic health record and the consent forms are on that, make sure that you use that. Make sure that it's documented. So don't just get a yes or no verbally, make sure that it's actually documented. And in from my perspective, I would definitely recommend that you have a witness. So have someone from your team basically witness that the patient did understand and that the patient's questions were answered, but also that they made an informed decision. So what was said to them, what they referred back to you, and that it was done in within the protocol, basically. So that is extremely essential. Okay, so to summarize, from a law perspective, the guardian understanding is of the great weight with regards to consent. Okay, and it is an important component. A signature with no understanding is of no value, and in fact will fire back at the physician. So as a physician, you make, like I told you earlier, you make informed decisions, so make sure that the patient is also making an informed decision. So going back to the question, all of you were right. The most defensible answer would be B. So in the case of a true acute phase where delay risks life, organ, or severe harm, the emergency threshold applies. Let's go on to the next question, please. So here we've got another scenario. So we've got a 6-year-old which presents with suspected meningitis with all the symptoms, the fever, neck stiffness, etc. So you recommend immediate intravenous antibiotics and admission. The mother refuses and demands discharge. So we're leaving now. What is the most defensible next step for you as the physician? Let the mother sign, give them the antibiotics and discharge, call security and treat against their will, or do you escalate? Or do you agree to no admission and ask them to return if the situation worsens? And I'll give you a couple of seconds. You guys are really good. Perfect. And I will tell you, not everyone gets this one right, surprisingly. Okay, so let's go on to the next question. So you decide that the child is high risk and you want to admit them now, antibiotics now, but the plan fragments. So one note says stable for discharge, but the antibiotics are delayed and the ownership is unclear. So what is your immediate corrective action? Do you assume everyone heard the plan and continue? Do you restate the plan out loud? Do you avoid confrontation and let it unfold? Or do you document later after the situation settles? Perfect. Let's go on to the next slide, please. Okay, so this is actually one of the most problematic pillars when it comes to emergency health in general, not just PEDS. So it's essential to know that the DAMA form is a record of an event, okay? So it is not a risk strategy. It will not protect you if the child is at risk. So your responsibility at the moment is the child. So your protection is escalation and a note that proves due diligence. So in DAMA legal cases, the guardians will almost always take legal action against the physician, unfortunately. And this happens immediately once the child deteriorates, and they will start blaming the first doctor that they saw. And the claims will be that, there is a delay, a failure to recognize the symptoms, a failure to recognize the severity, failure to inform and escalate, and failure to document, and also failure to risk take. So they're basically a list of accusations that go against the physician. So therefore, if the patient is at risk and DAMA is requested, your defensible position is escalate, stabilize, and coherently execute. So going back to the question, the best answer was C, signature, document, refusal, and it doesn't replace the due diligence in this situation. Okay, so on the other hand, in legal cases, many failures are also part of the team execution failure. So inconsistent plans, missed timings, unclear ownership. When a complaint appears, the physician is often treated as the captain. So basically, you guys are blamed in every situation. Let's be honest. In that basically scenario, when the harm was caused by another team member, you are still being blamed. Okay, so your discipline is simple in this situation. One plan, one leader, closed loop confirmation, and documentation that aligns across the team. And I mean, it is a big load, but then again, the position comes with a lot of responsibility. So you are the team member, the team leader, sorry. So of course, just keep everyone in line and make sure that everything is documented. So documentation is the most important part of all of this from a legal perspective, of course. Okay, let's go on to the next slide, please. So another scenario, we've got a 4-year-old that presents with concerning bruising, and basically the story does not align with the injury pattern. The caregiver becomes very hostile and basically just says, if you accuse us, we will sue you. And to be honest, most of the time they do not say this, okay? They just basically, and you guys know, they just brush around the bush. Okay, so the question is, what is the safest way to handle this? Confront, document, treat and discharge to avoid conflict. Perfect. Okay, let's go on to the next slide, please. Okay, so the third pillar is safeguarding. And this is where the HAT discipline really, really matters the most, okay? So you are a clinical witness. You're not an investigator. You're not a judge, and you are not a social servant. And I know that most of the time, these cases are very heartbreaking. And sometimes, especially women, we try to be the mother, basically, which is not the right thing to do. And it's a common trap, okay? So overreach is not recommended in this situation. So basically, don't give personal directives. Don't give advice. Okay, so even if well-intended, that steps beyond your role and increases exposure to defamation claims. And there are multiple cases that have came through to my office where a doctor acted from good intent and basically documented in the notes that there is suspicion that this relative did this or that, or that this scenario happened. And sometimes it actually can be, unfortunately, the situation where the physician is used as the bait. So there could be a bigger problem at hand. It could be like as simple as a divorce lawsuit between the parents, and one of the parents uses the physician as their trophy in their own divorce lawsuit. So they will actually say some things. They will trigger you, and they will try to get you to either write certain things in the notes or imply something. And then when you take the action, and they will be very vague, they will want you to be the open book, right? They will then use your own words against you in the other lawsuit, for example. And then you will have the other parent come against you, and it's you basically get yourself in this whole mess. So to avoid all of that, try to be completely objective. Keep reminding yourself that the patient is your responsibility, not the other situation. But of course, that being said, you will take the necessary action. So you will escalate within your own hospital protocol. So that, I mean, it differs from hospital to hospital. Some hospitals prefer to deal with it internally. My advice for you would be notify internally and also externally. All right. For the safety of your patients. So that could be by calling 1919, which is the Domestic Violence Reporting Center, or you can immediately contact the Ministry of Human Resources and Social Development. And in some situations, it would be preferable just to immediately also call the police. And when you do that, from a legal perspective, do not give any implications to the family. Yeah, so this is your job, and you don't need to notify them. Just do it very discreetly without them knowing, and just make sure that you get all the information without exposing yourself to danger. because of course you do want to avoid that defamation lawsuit. Okay, so we're going to activate the system. Do not try to be the system. Document objectively, report through your hospital safeguarding pathway, and make sure that your notes are extremely clear and are in line with the actions that you are taking. And within the notes, do not use accusation language at all, because I've seen it where, even the medical notes can be used against the physician. So make sure that also your notes are very objective. Okay, so going back to the question, the best answer was C. And it's important to highlight here that safeguarding cases can be emotionally heavy. And if a case affects you and affects your judgment, escalate early, but also seek support, seek professional support, because professional resilience is a huge part of safe care. And so if this is available at your workplace, perfect. If not, then seek help outside your workplace. That could be through a psychologist or a coach. And I mean, also with me, part of my work is also empowering physicians and coaching them through difficult situations. So let's go on to the next slide, please. So you need to document an injury that may be relevant for safeguarding and later review. So what is the most defensible documentation approach? Take a photo on your personal smartphone, upload it later. Basically describe the bruise and the injury in the notes only, or none of the above. Yeah, I'm waiting for the answers in the chat, guys. Okay, you all got it wrong. Finally, I win. Okay. So let's explain that. So let's go on to the next one. Ramla, we're not going to accept this answer because you were too late. Okay, so let's go on to the next slide. Yeah, perfect. Okay, so pillar 4 is documentation and forensic integrity. So if it isn't documented, did it happen? Okay, so this is the important question. So if it's not in the notes, did it actually happen? So your personal smartphone is actually a liability magnet. Under the personal data protection law, you're not allowed to use your personal devices for clinical imaging, right? And it creates a serious privacy and governance risk. So you are supposedly required to use hospital-approved encrypted devices only, and then follow your institutional policy. So if the device protocol at your hospital is unclear, make sure that you ask. And when you do ask, make sure that the answer is written and documented, not just a verbal answer, all right? Just in case, la samahallah, you get a case, then you have that documentation to prove. So if your hospital says it's okay to use your personal phone, take a photo, and then delete it after you send it to the system, perfect. Make sure that you have that documented, just in case you have a situation, then you have that in your defense. Tamam? And if your hospital does not have a protocol, then definitely ask for it to be implemented ASAP. So an internal policy to protect you and the patients at the same time. Okay. So the actual correct way, let's say, the legal way to do it would be to identify, so confirm the correct patient identity per policy. So that could be through the number, the ID number, the name, etc., whatever your system is. And I would advise you to use all three. And then orientation. So show where on the body the injury is. Take that photo. Obviously, try to minimize the face, basically. But if it's on the face, then take the whole face while covering the eyes. I mean, there are different protocols depending on the injury itself. And then 3, take a close-up. And if possible, use the scale. But if you don't have the ruler, if you're like, especially in emergency medicine, you don't have the time, you don't have the luxury to do that, then use something that you have that can be used as a skill. It could be a pen, it could be just anything that is well known and common. And then you can take another photo to measure that the item that you used as a skill. And these are essential when it comes to forensic investigations and lawsuits. All right. So yeah, you need to, so in related cases, the focus of the case is what the record cannot prove. So the red flags explained, escalation performed, write the notes as if, and this is essential. So when you write the notes as if they will be read by a medical student that you are teaching. What would they need to know? What would they need to see? This is exactly what you're doing when you have a forensic situation. So going back to the question, the correct answer was C, actually, none of the above. All right, so finally, regarding artificial intelligence, and as you all know, this is becoming more and more part of the medical treatment and investigation. So despite that, the clinical responsibility remains on you. Okay, so if you do use AI, it is essential. I cannot emphasize this enough. Always document that I reviewed the findings. I was assisted by so-and-so, and my clinical determination is so-and-so and so. So never just put the outcome from the AI as your own, because as you know, AI does make mistakes, but also include that you did use it. And as a side note, if you have the luxury to actually consent with the guardian or the patient, always ask them or always tell them that, we're going to use AI to investigate, for example, and get their consent. So if the patient says no, and you have the luxury of that, so it's not an emergency situation, then you need to adhere to the patient's request. So no means no, if you have the luxury, if it's not an emergency situation. Okay, and let's go on to the next slide. So going back to the questions, so is this an emergency? Is it life, limb, organ, or severe harm risk? Who can consent now? So do we go through the traditional informed consent route, or do we have an emergency threshold? What is in the child's best interest today? What harm are we preventing right now? Are we saving the child's life, or are we actually putting the child in higher risk? For example, the cases of domestic violence, etc. And do my notes prove exactly what the thought process was, what the risks were, the reasoning, the communication, escalation? And I think we have time for questions. Yeah, we've got plenty of time. So thank you all. I hope that this was informative. I hope that you enjoyed it as well. Yeah, thanks.
Thank you, Dr. Hayathem, for this insightful and impactful session. To be honest, truly, it's valuable for it's not only for emergency physicians, even for every physician around the world regarding the medical law. We are open for questions if anybody would like to have questions to Dr. Hayathem. I have a question from my side, Dr. Hayathem. From a legal perspective, what documentation practices truly protect physicians in court, not just good practice, but defensible practice?
Perfect. That's an amazing question. Like, I would say definitely. Okay, let's start from the beginning. Let's say that someone has a lawsuit against them.
Mhm.
Immediately go consult a lawyer. يعني بأمان. لأن let's think of it this way. All of you guys spent many years studying medicine. We're talking about another field which is basically completely alien. All right. So it's important to get that legal advice, because sometimes there can be loopholes, or out of practice, out of familiarity, you just act on what you've done for such a long time. But let's say there's a change in the law, for example, especially now with AI, it's essential to go and get advice immediately. After that, when it comes to basically, معلش اتلخبطت شوي. Your question was about what, documentation or the legal? I'm going to turn off the chat.
Yeah, documentation.
Documentation within like the clinical scenario, or when it comes to a legal case?
No, legal case.
Okay. So, and in that question, do you mean when you present your documents to the court, let's say on nudges, or what?
Yes, to the
Okay.
court, when I presented
Okay.
to the court, actually.
خلاص, yeah. Then definitely go through the route of the lawyer, get legal advice immediately. And when you do pick a lawyer, make sure that you're picking a lawyer that does know what you're talking about.
Mm-hmm.
لأن كمان the other issue is that if you go to a lawyer that does not understand the aspect of the medical field, there will be some things that will be lost in translation بأمانة.
Uh-huh.
اوكي يعني الكل خير وبركة والله يعطيهم العافية جميعا يعني والكل ينوي خير. لكن let's be honest, as a physician, you would want someone who understands why you acted in a certain way, and understand the whole situation as it is. تمام? And when you do present your documents to court, all right, we're going to go back to what we said in the lecture. Make sure that you completely dissect every single detail as much as possible. This is the
Okay.
best defense.
Okay.
Regardless of how long it is, just make sure that you are basically as if you're teaching it to a medical student, right? Because you
Yeah.
are dealing with a lot of people who are out of the field, and that is completely fine. You know, like just like you guys don't know the ins and outs of the legal field, people outside the medical field do not know the ins and outs of the medical field. So keep it very basic. And also to start with, before you get to that situation, لا سمح الله يعني الله يحفظ الجميع, always make sure that your medical notes are A star. Completely detailed as much as you can. لأن كثير من المرات اللي أشوف الكونسنت يكون إنه والله explain to patient confirmed. الترايل يطلع البيشنت له عارف السايد effects, what are the options, so basically they're not informed, right? So it's important to make sure that you take every single step throughout the way and just give as much as information as you can. Don't assume that the person that you're speaking to or that you're writing to is at the same level of knowledge that you are. احنا مختلفين يعني ما في إنسان يعرف كل شيء. اللي يعرف كل شيء هو الله سبحانه وحده. You have to be detailed.
Yeah, you're right. I can't agree more, to be honest. And you have answered about the documentation and details, and I can't emphasize how it's important that we have to write our notes and details a part of writing it instead of two lines for let's say protection purposes. There's another question from the chat, Dr. Arwan asking about in case if one caregiver is accusing the other one with sexual or physical abuse and declare that they are in parental custody lawsuit. What would be the safest way to document this in medical records?
Perfect question. وهذا ترى this is very common, unfortunately. And this is what I was referring to when I was talking about that you as a physician, يعني بسم الله عليكم, بس like let's say a physician is being used as a tool in a bigger case. عادة في هالحالات يكون إنه والله there is a divorce lawsuit between them or whatever, or the physician is being used. So sometimes, and the thing is, we want to remind ourselves, you are the physician, you're not investigating. So we don't want to get into the depths of like, is it true? Is it not true? So the best way to document it is, for example, that this person, which is, for example, the patient's mother, claims that the father did so and so. So state it as it is. You're just telling the story. You're not, try as hard as you can to not go into investigator mode. I know that as doctors, you are investigators by nature, but this is not your field. It's not your duty. Just stick to what you have to do. So just say the mother claims that this happened. Well, that's it. Well, definitely for sure, I would 100% recommend always have a member of your team act as a witness. So when you write the notes, make sure that the team was there, if you can, a nurse at least, whoever you can. وخلاص, just get her to sign saying that, yes, I confirm that I witnessed this. Because the amount of times that this stuff is used in another lawsuit is insane. And in this situation specifically, the father most definitely will go after the doctor. I've seen it. I've had multiple cases where doctors come to me ومن medical records لأن بعدين مثلا the mom for example comes into the hospital, asks for the medical records, she's given the medical records, she takes it, she uses it in her case, which is the divorce case or whatever she has going on in her life. The father finds out and then has a defamation lawsuit against the physician. So as a physician, instead of going on by your day and saving patients, you're then dealing with this nonsense. Tamam?
Mhm.
So just make sure that you're safe, that you know what you're saying. And the situation here was that unfortunately, many of the doctors just say, they take the mother's words as concrete وخلاص يعني instead of saying claimed يكتبون مثلا ان the mother حتى بدون the mother the father did so and so. They completely يعني يتبنون فكرة الأم أو أقاويل الأم وهذا خطأ.
Uh-huh. And we have to document that in details in our notes just to protect ourselves at the end.
Yes, for sure. Always say that the mother claims so and so. لأن at the end of the day it's a claim. إحنا ما عندنا يعني مهما كانت الأدلة واضحة هذا ما هو شغلنا كأطباء.
Yeah, that's clear. There's another question by دكتورة عالية.
معلش
Which
سؤال بس بضيف على النقطة اللي إنه كمان when you do write that the mother claims so and so.
Mhm.
Also document directly after that what your action plan was, which hopefully you took into account. اللي هو إنه مثلا I escalated and I took these measures according to policy. حتى you don't need to mention according to policy. Just say that the mother claims so and so, and this matter was escalated. I informed so and so. I called 1919. I called the police. Whatever it is, just make sure that it's in the same paragraph.
That's clear. Wonderful. There is another question by Dr. Alia. Which evidence or emergency physicians required to collect according to Saudi child abuse protocol? Actually, do we have a protocol for the child abuse in Saudi?
It differs from hospital to hospital. And this is a situation that I noticed. لأن كمان شوفي, the issue is that you guys have multiple policies that you must adhere to. So you have the internal policy of the hospital that you work in. تمام? But also then you have the national policy. Obviously, adhere to the national policy. So or the national law. So what does the law say? The law says that you act by basically escalating and informing the officials 1919 or call the police, whatever is the easiest for you. But you need to inform the government entities which are responsible for protecting the child. تمام? My advice to you would be if there is a conflict between internal policy and national policy, of course, stick to national policy. الحلول بالقوانين عندنا بالسعودية, everything is on the website of the Ministry of Health. So it's very easy for you guys to find. I know when it can be very overwhelming, but your basically your tool, your safety, your superpower is knowledge. You have to be knowledgeable when it comes to laws, تمام? And then just basically the evidence that according to her question is like, what is the evidence that you need? So just get as much information as you can, and when you do ask a question, ask them discreetly, right? Because most of the time it is the abuser that brings in the child. تمام?
Yeah.
So you have to be very, very discreet. Don't put yourself at risk and don't put the child at higher risk, because the easiest thing that the abuser could do is just pick up the child, take them out, and leave the minute that they feel that they are at risk. And of course, we all know that that means more harm to the child. So act discreetly. Just be very observant and ask the questions which will be more informative to you. And the minute that you realize that it's something bigger than what they are trying to present, خلاص. Just take action immediately. Leave discreetly, make the necessary calls. Make sure كمان المشكلة الكبيرة اللي هنا في الحالة هذه إنه كثير من المرات the nurses assume that the patient doesn't understand English.
Yeah.
Or that the guardian doesn't. معلش أغلبية الشعب السعودي يتكلم إنجليزي. ف using English as يعني كتشفير, it doesn't work anymore. Yeah. So one of the things that I advise teams is to always have a code word between you guys. كلمة ما حد يفهمها إلا أنتو. And you as the team leader, just tell your team, when I say this word, it means go call 1919. or go and call the police. And make sure that it's a very discreet word, whatever it is. Because most of the time, the nurses, unfortunately, they forget and they would say something that would put you and the child and the team at danger.
Perfect. Perfect and clear. There is another question by Dr. Bassam regarding describing injuries in our hospital form. We have to write how it was inflicted. We used to write sharp versus blunt trauma, but sometimes we asked to name a specific instrument. What is the right way to do it?
Excellent questions. طيب, use the information that you have. If you are not sure if you're not sure what the instrument was, just refrain from naming it. لأن مرات ما يكون واضح. And again, you're not being the investigator, you are the physician. So you can say that, after writing everything, you can say, it appears that it may be so and so. Or I have a huge belief that it can be so and so. The best way to do it is to basically العبوا بالكلمات. لما تجي على الوصف في فرق بين إنه I am definite this was used by a knife or this was done by a knife or I have an assumption that it could be a sharp object. I mean, and these are clear for you guys. You know the difference between something which is blunt and sharp when it comes to injuries. Just use the right wording to make sure that you're not using accusational language. Okay, because you don't know what could happen after that. And when I say these things, I don't want you guys to operate from fear. Think of it as your superpower. You are basically stating a fact, and you are stating a fact that in a way that is objective, but also that is extremely clear without making accusations.
That's clear. There is another question by Dr. Rawan, and it's the same thing with Dr. Shahad. They're asking the same question. In case of refusal of intervention, if there is a variation between mother and father, one is accepting the intervention and the other is refusing, what would be the best line of action from legal point of view? I know you said don't go deeper, but what if one is working in the best interest of the child? Plus, Dr. Shahad, she adds, can she take a consent from the father or she has to take from both? There one of the parent or guardians refused for the intervention.
Okay, perfect question as well. Always act in the best interest of the child. Okay, so if both of them are giving, wrong kind of consent, if they both say no, for example, and it's a necessity, you know that you are going to do it regardless of if, they give consent or not. But in the situation that one says yes, the other one says no, you're going to go with the one that basically is in the highest interest of the child. So one consent is enough. You don't want to get into a family situation because again, your main concern and the person that you are responsible for is the child. ما هو استشارة عائلية ما له علاقة. What is the best interest of the patient? Well, that's it. And just document that. When you do that, make sure that you are, and I know that you guys don't have time to write all of this in the notes, but please make sure that you do. حتى لو كان بعدين. Or whoever is, from the team with you guys and isn't doing anything at the moment, they can take the notes. Allah, the mother said so and so, the father said so and it is in the best interest of the child to do this and this. Therefore, we will do this based on the consent of this patient, or based on neither of their consent because we're saving the patient's life. So patient first, وبعدين عاد الأمور العائلية.
Yeah, actually, we're facing it more frequently in our EDs regarding refusal of intervention. One of them agreed and one of them not. From my own, to be honest, perspective, I'm giving them a time, at least of 5 minutes, to put an agreement in regarding to the intervention, especially if it's not something harmful for the kid. But I totally agree with you, to be honest, Dr. Hayathem. That's the best approach. Another question.
Can I just add something there that
Yeah,
it's good that you give them that time. بالعكس
yeah.
هذه حركة جدا جميلة لأنه كمان at this time you can go and just like write in the notes إنه والله هذا الوضع اللي حاصل الأم رافضة الأبو رافض whatever it is. و in this time, if in this situation that it's not a health risk, you can escalate. You can I mean, that's the thing also, because in a lot of the cases, unfortunately, الوضع يكون one man show or one woman show.
Yeah.
And sometimes you guys don't like to ask, which is يعني why not ask, get another opinion. ما هو تقليل في شأنكم أبدا، بالعكس, it actually protects you. Then the more opinions you get, the more that you will be able to also make an informed decision. And you can write that in the notes. وما هو تقليل من شأنكم أبدا، بالعكس, it's actually, it empowers you more. It's in your favor. إنه والله إنه لا سمح الله صارت قضية إنه والله I asked this person or my superior, if in case in the situation that you do have a superior, now well I asked this person and this is what they said. And then you make the decision based on all the information that you have وترجعين للpatient واللي يكون وقتها مثلا the parents اتفقوا ما اتفقوا, you already have your answer and your decision.
Yeah, I totally agree with you. Another question. What about in Saudi law? The primary guardian is the father. Is his signature superior?
Yes and no.
Uh-huh.
So yes, if he gives an answer that is في صالح الطفل, okay, the patient.
Mm-hmm.
No, if what he says and what he decides goes against the greater good of the patient. So number one is always the patient. أبيكم تطلعون من الرعب اللي who is signing what and who is saying what, then at the end of the day you guys are responsible for the patient. إذا ثبت إنه, because you guys are emergency medicine, right? So we're going to talk about the extreme situations, not the الأمور العادية. Extreme situation, what is in the best interest of the child, what's going to save the child. And you will do that regardless of what the consent says or doesn't say. Either wallah, we have the luxury of deciding and it's not an emergency situation. In that case, think about the greater good. وش الجواب الأفضل? So it's about basically evaluating the pros and the cons. تمام, but I assume because you are emergency medicine, you're not doing something that is يعني it's not essential. In that situation, you won't do anything that is not essential and you will just stick to the consent. But if it's essential, yeah, obviously override the consent.
Yes, I totally agree. And it has, to be honest, it comes to our mind always when we take some consents that the father superior that rather than the mother and signing it, despite the decision of the mother. But you make it really clear, crystal clear for us, and for that matter. There's Sadim. I don't know if she's asking a question or she is commenting. We always face this issue. As father mentioned, he is the superior, one over the mother. So it's still not clear and it causes conflicts with us. So I think she's commenting about it. Yes, I
هذا هو.
valid. Right.
I mean, I agree, it does happen, but يعني شوفي في الوضعية هذه you are in control. تمام, لأنه نرجع نقول مثلا ما بندخل في أمور عائلية. It's fine. Who is the priority here? The patient. عادي يعني مو not everything requires a comment. You know what I mean? In the situation of like in the ED, tamam, or in the clinic. You don't you just act in the favor of the patient and there doesn't have to be that much of a confrontation. Okay,
Yeah.
because the law will be in your favor. So in the case of an emergency, لا سمح الله, so life saving, or there's a risk, limb, etc., like we talked about, organ, you would have had already escalated the situation. تمام? So don't go into a long discussion with the parent or the guardian or whoever brought the child in. Give yourself يعني قيسي الوضع من البداية. شفتي إنه والله ما في فايدة من الحكي, which
Mhm.
happens. أنا شرحت الموضوع, قلت لهم ما وافقوا أو اختلفوا الجماعة مع بعض أو whatever, دخلنا في أمور عائلية, خلاص أنا أعطيهم ال5 minutes اللي أنت قلتيها دكتور يارا. I go escalate the matter, I write everything in the notes, أرجع لهم إن شاء الله تكون هدت الأمور, أوضح لهم الأمور وخلاص. فهو البروتوكول زي ما قلنا إنه talk to them بعد فحص patient and everything, talk to them, explain the situation, document objectively, escalate if there's a need to escalate. وبعدين كذا تجري الأمور. فما تفرق في اللحظة في الوقت هذا أو في السيناريو هذا إذا والله someone claims that they are superior. At the end of the day, the child is superior, to be honest.
Yeah, that's clear. بصراحة أعطيتينا ثقة. You gave us the highly confident in approaching such cases. Last question from my side. In Saudi pediatric emergency settings, what are the most common medico-legal pitfalls physicians still fall into, and how can we practically avoid them?
حلو السؤال. طيب نرجع لموضوع الكونسنت. لسه في موضوع الكونسنت. اوكي وال documentation. والله فعلا documentation is a huge issue. لأن most of the time people just go with bullet points. Very concise. And this is a problem because at the end of the day, the medical notes are your hugest defense. If the medical notes are perfect, زي ما قلت لكم, it's like you're explaining to a medical student. Or in other words, think of it as something that will be read. لا سمح الله عرفتوا بس إنه it will be read. Good or bad, it will be read. Make sure that you document absolutely everything because, to be honest, this is the issue, the documentation and also not getting the right consent, which has also the element of undermining the guardian or the patient. Or in your cases, it's the guardian because your patient is the child. So always respect them. There might be a knowledge gap, but also this is not always the situation. There are a lot of, all of you have been patients at some time or the other, or you've been with a family member. So you can see how sometimes you would be treated differently if you introduce yourself to the doctor as a doctor. But if you go in without introducing yourself, you will get the regular treatment. So sometimes, let's be honest, you will be spoken over. You will be ignored. Let's be honest. في أخطاء في عيوب محتاجة تحسين. فمن ضمنها إنه when you talk to the patient, talk to the guardian and the patient at the same time. Include the child as much as possible. So now we're getting to the ethics of the medical practice. But like I said, document absolutely everything and always keep in mind the best interest of your patient.
You make it clearer. So documentation is the cornerstone for protecting ourselves as a medical providers. I think we were coming to an end, Dr. Hayathem, and really I can't appreciate your presentation and your talk and your insightful and impactful session, which is truly valuable for every pediatric emergency and emergency physicians in the kingdom. And thank you so much for your presence. And anyone in the audience would like to communicate with Dr. Hayathem, medical law firm, this is her number and this is her website. You can reach her. Thank you so much, Dr. Hayathem, for your time.
Thank you وشكرا لوقتكم جميعا وإن شاء الله أنكم تكونوا استفدتوا. ما شاء الله عليكم أغلب الإجابات صح ما عدا الكويستشن الأخير اللي أنا غلبتكم فيه. I was intending on giving a free consultation to someone. If there was one person who had answered all of them correct, بس ما شاء الله كلكم جاوبتوا صح, so it's going to be a little bit difficult to do that. بس زي ما تفضلتي, I'm always available. Thank you for sharing my information. If you guys have any questions, I'm always available, and it was a complete pleasure. Thank you so much, Dr. Yara.
الله يسعدك الله يسعدك. ألف شكر. Thank you so much.